Hello, I'm Vicki West, the Thoracic and Lung Health Nurse Navigator here at Chesapeake Regional Medical Center. We're here today to discuss the shared decision making for lung cancer screening using a low-dose CT scan. This is a required part of your office visit. Before I start, let me just say, prevention is the best cure. If you smoke, you need to quit. We have a smoking cessation program here at Chesapeake Regional. You can meet with a therapist one-on-one and she can tailor the program just for you. All you have to do is call 757-312-5256. There's also the 1-800-QUIT-NOW. Counselors can provide you helpful information, advice, and support. We also have smokefree.gov. They have many tools and tips to help you. The point is, all you have to do is make the call. And for those of you who have already quit, good for you. Screening for lung cancer increases the chances of detecting the disease early, when it's most treatable and potentially curable. The thing about lung cancer is by the time you start feeling something isn't right, it could be too late. Lung cancer kills more people than colon, breast, and prostate cancer combined. Of course it does. By doing these yearly CT scans, we save 20% more people. That's about 30,000 fewer deaths from lung cancer per year in the U.S. So yes, it does matter. You might ask, well, why a CT scan? I had chest x-rays before and they were okay. Unfortunately, chest x-rays don't catch lung cancer early. They are not effective. It's a special type of CAT scan with less radiation than a regular CT scan. It only takes a few minutes and the entire appointment will be about 30 minutes. Lung cancer screening is not a single test, but a process that needs to be done correctly. Here at Chesapeake Regional, we have everything in place to help guide you. A board-certified radiologist will read your scan, and if there's something to be discussed, a group of lung specialists will review the scan together to determine the best recommendation for treatment. So remember, even if you have a clean scan this year, you must stay with the program and continue getting scanned yearly for as long as you are eligible. If the CT scan is clean, you're good to go for a year. If a lung nodule is found, your doctor may recommend a follow-up CT scan or another procedure. There are some potential risks with lung cancer screening. However, you need to understand the process. We think it's a good idea, but it's up to you in the end. Let me explain. This test uses a low dose of radiation and will expose you to less than 1.5 millisieverts. This is much less radiation than a conventional chest CT scan, which would expose you to 7 to 10 millisieverts. To put this in perspective, the average person in the U.S. is exposed to approximately 3 millisieverts of natural background radiation every year. So a low-dose CT scan is not that much more and is beneficial. Overall, the benefits of screening outweigh the risks. CT scans often show more than what we want to see. Years of smoking have left marks on your lungs that are going to be seen on your screening CT scan. More than 90% of those abnormalities on the screening CT scan will be benign. But occasionally those abnormalities require further testing and cause unnecessary stress and anxiety. These false alarms are called false positives. We have a process to filter the false positives, and sometimes we just end up watching them over time to make sure. Not everything we see on your scan will require a procedure or intervention. We'll guide you through it. We cannot always tell a bad nodule from a harmless nodule. Sometimes screening finds nodules that look and possibly behave like cancer. This may lead to a biopsy or surgery. Then we discover the nodule may be slow-growing cancer that isn't causing any harm, or might not be cancer. The patient may suffer a side effect from the procedure or treatment. That's over-treatment or over-diagnosing. The best way to avoid over-treatment and over-diagnosing is to understand your options and discuss procedures and treatment with your physician. It is your right to understand all options, risks, and benefits for each approach. If anything on this video is unclear or you have some questions, please ask your doctor or call me at 757-312-3012. We are now done with the shared decision-making session. You will be getting your scan soon.